Hey everybody, welcome back to another episode of Hybrid Healing Hour. Today we're going to be talking about Integrative ENT, which is ear, nose, and throat, with a highly trained professional, Dr. Linda Dahl. Thank you for joining us.
Thanks for having me.
I'd love for you to introduce yourself and tell our audience a little bit about yourself and how you got to where you are today.
Sure. My name is Dr. Linda Dahl. I am board certified in ear, nose, and throat medicine, and I've also done some training in integrative medicine. I think I did it about 12 or 13 years ago, and I've been in practice almost 22 years. So more than half of my practice has been including integrative treatments. But I did spend, a good, close to 10 years really just doing traditional ENT. And because I felt like I hit so many roadblocks with my patients and trying to heal them, I wanted a more holistic approach, which is, I guess, kind of the opposite of most subspecialists, because and in the training of ear, nose, and throat doctors, it's becoming more and more kind of microscopic and specific. There's a lot of they do a lot more with surgery and a lot more with really focusing down on the on the problem. And for myself, I really wanted a bigger approach, and I found that using integrative techniques and perspectives, I've been able to heal and treat a lot of my ear, nose, and throat patients in ways that I never could have before. And so now in practice, I treat adults and children. I have a general ENT practice, but everything I do has that integrative component to it. So I use whatever we need to use in the toolbox. I personally am not doing surgery anymore, but I did surgery for 17 years. And so, if people do need surgery, that can be a component of it as well. And I treat a huge number of professional actors and singers on Broadway. It's not the only thing I do, but it's a big part of my practice as well.
I'm sure that's very important, since they have a singing career and their career depends on that. You probably become very important in their lives.
And you hit upon something.
And integrative treatments are essential for them because it's really a whole body exercise. So yeah,
right.
For sure.
Oh, I can't wait to dive into this.
You hit upon something that's a common theme with a lot of us who do integrative medicine is that we all start out doing traditional medicine. And after a while, you get frustrated that you're not really making much of a difference, and you're throwing everything you can at them. People still aren't getting better. And I'd like to say that we met you originally at one of the large integrative medicine conferences where you were a speaker, and we were really impressed with the things you had to say. And it's great that these conferences, we learn so much and meet such interesting people, and your whole story and your background and your career is amazing. And so we're in Florida, you're in Manhattan, but we've still sent patients to you.
Yeah, you have. It's been really kind of great. Yeah, I think after the pandemic, medicine became kind of more national, global even. But yeah, it's been wonderful being able to interact with physicians outside of New York. Especially, I love these integrative conferences because doctors and other healthcare professionals come from all different specialties. And it's kind of like using those techniques in our field of study as opposed to, partitioning out the body just the way medical schools have partitioned out, ear, nose, and throat is its own specialty, but it's really part of the whole body.
Yeah.
The body hasn't said everything stops here. Like ignore everything from the clavicles down. So yeah, so it's been wonderful meeting you and other integrative doctors and learning from everybody in those conferences more than I really do in my own specialty, the conferences for my specialty.
So a lot of times when we talk about integrative medicine, I feel we talk about gut microbiome, and that's become a very big, I guess, topic these days. I think it's becoming more aware to people of how the gut is related to so many different parts of the body and the whole body. So can you go ahead and maybe explain if there's a role of gut microbiome in the sinuses and in ENT in general?
Yeah, just like I said, from the clavicles down, the body doesn't stop. There's actually a microbiome in your entire inside. So the sinuses and the oral lining, everything in the throat up to, down to the esophagus and including the gut and on the way out. It's really the ear, nose, and throat part of the body is the other side, or the beginning part, I should say, of the internal microbiome. And then, of course, everything on the outside of us, on our skin, has its own, separate microbiome. And what's really interesting about the microbiome in the head and neck area is that, unlike or differing from the gut, where we kind of think of it as one microbiome, in the upper respiratory system, it changes depending on the location you are. So, the skin has its own microbiome. The front of the nose is different than the back of the nose, is different than the throat, and is different from the larynx. So, when people get sick with whatever it is, or get inflammation from allergies, for example, or they get sick from a virus, then it's really the intermixing or the traveling of one microbiome to another location that, quote unquote, makes them sick. And I think it's a really fascinating way to think about upper respiratory illness, especially since I think, what is it, like 75% of, urgent care visits are for that.
Yeah.
And I think if we really kind of approached it and looked at it this way, there are a lot of other treatments we can do, and a lot of other ways to construct treatments that aren't kind of the traditional antibiotic steroid, or surgery or whatever, that can really bring the whole body back into balance.
Right. And so basically, I guess that kind of alludes to another question. So, like, what is your go-to for, chronic sinusitis is so common, and then there's acute on chronic, right? And so, we're big on preventive measures, and we use a lot of the mushroom extracts, like my community. We also are big on NAC. Like, do you have any other holistic remedies or something that you're a big fan of in prevention?
Yeah, this is a big topic, and I can talk about prevention. I can also talk about, kind of the way I look at upper respiratory illness, because I think there's so much confusion in diagnosis, right? So is it a cold, which is viral? Is it bacterial? Is it a sinus infection? Do people just get one and get over it? Do they get one and, another one back to back? And sometimes I have patients, very often, where they get their first sinus infection, they get treated with antibiotics, and then they just get them every 2 months, over and over and over again. And I found that in chronic sinusitis patients, they tend to have a very delicate microbiome, meaning that sometimes even one course of antibiotics can throw everything off so much that they don't have enough diversity in their upper respiratory microbiome to counteract the overgrowth of one of the other bacteria, or candida, yeast. And we can talk about later, but there is that, that one dose for some people of antibiotics, especially if it's strong enough, really disrupts everything enough that there's less competition between the bacteria that are already living there. And so anything that tips their immune system a little, like if they don't get enough sleep, or if they have a bad allergic reaction, anything like that can set them up to develop another bacterial infection, and then they get more antibiotics. And then it just kind of sets them on this, roller coaster of medicine. And then traditional ENT will they'll say, okay, well, now you need sinus surgery. But sinus surgery really just opens up anatomic blockages. But the real organ of the upper respiratory system is the lining. And surgery, there's only so much you can do with the lining. Like, the lining has to be maintained, its microbiome has to be maintained, because if it isn't, then all that mucus can back up in the sinuses. So the dynamics of the sinuses are a little bit more complex than like the gut, or say you get like a cellulitis of your arm or whatever. So preventatively, I like to tell my patients to make sure that there's enough room in their sinuses. So they have to keep their sinuses aerated so there isn't blockage, and also allow that mucus to keep flowing through. And if there's an overabundance of it, to dry it up so it doesn't travel, so one microbiome doesn't travel into the other section. And some of the products that I love are focused, some of them are focused topically, and some of them are more systemic. So along the line of mushrooms, the product I love the most is Immucor from Metagenics. I've been using it for over a decade. I have no affiliation with this company. But I think, yeah, all of Broadway is taking
What's the
them.
active ingredient in that?
It's a combination of different mushrooms like cordyceps and reishi
Oh,
and ashwagandha, and then there's also some. I think there's some niacin and other vitamins in it. It's unbelievable
well,
how it works. And I have a lot of patients who are just on it every day. It really quells the number of infections they get. But sometimes the way I use it is if I start to feel like I'm getting a cold, I'll just take two of them while right in the beginning when I'm starting to feel sick, and often that works better for me than antibiotics or other medications like that. So that's a great prevention. And then up in the Northeast, everyone is low in vitamin D. When you're low in vitamin D, it also changes your immune system so that your body is more allergic. It reacts allergically, and it is less capacity to fight off bacterial and viral infections. So I've had a lot of chronic sinusitis patients in the Northeast where I just put them on, I test their vitamin D, I keep them above 50, and they don't get sick anymore. It's
yeah.
amazing, especially those theater people because they're always inside, always
Right.
Well,
inside.
even in Florida, everyone's low in vitamin D, so I think it's a universal thing.
Oh,
Yeah,
geez,
Oh,
yeah,
yeah.
and
possible.
they're getting enough sunlight, they're just not converting it, and there's so many other factors. We did a podcast on vitamin D, and it's amazing at how low our patients can get. I mean, we're talking like 5, 10, very low
Wow,
levels.
Yeah.
that's amazing.
Yeah,
Yeah, I mean, I'm surprised when my patients are not low in vitamin D.
yeah, us too.
Surprised, yeah. So preventatively, right? Those are the two main ones I use. Topically, there's another product that I love, and they keep changing the name of it, but the company is called Physician's Strength. And sometimes it's called Sinu Power or Sinu Orega, but it's basically a saline nasal spray that has just the perfect amount of oregano oil and clove oil. And using that regularly is I think it is a way of kind of cleaning out your filters. So it regulates the microbiome of your sinuses. So kind of keeps the candida in check, and it can also be regulate the diversity of the bacteria. If if one bacteria is overgrowing, it can bring it back into balance. None of these claims, by the way, have been proven through the lab. There's no research showing this. This is just what I've noticed clinically in my
Yeah.
patients. And then there are the more just sort of over-the-counter traditional approaches. Like for some people, they have such severe allergies, they need to treat the allergies, or they'll have inflammation all the time. And natural products are things like a combination of bromelain and quercetin. Those are a
Mhm.
really good combo. Sometimes that's not enough, and so I'll put someone on a regular antihistamine like Claritin. I don't love the steroid nasal sprays. I think that there really is. I've actually found in a lot of my patients that they have systemic absorption of the steroid, and it can impact their adrenal function. And also, I think the chronic steroid use thins the lining and can lead to more kind of candida and yeast
Mhm.
overgrowth, which we don't want. And so I tend to like the antihistamine nasal sprays, and the over-the-counter version is Astapro and Azolastine, there's also a prescription version. So those, yeah, I try to stick with topicals as much as I can for those things, but sometimes people need the systemic antihistamines, especially, and again, this might be different in Florida, but because of climate change, the growing seasons are so long that the amount of pollen when we get pollen it isn't even like allergies are really an overreaction to something that's not going to hurt you. But there's so much pollen, there's so many allergens in the air that people react to that overabundance, not because they're too sensitive, but because there's just so much of it.
Yeah.
Their body's going to have a reaction. And we have a lot of mold, tremendous amount of mold in New York. Dust. So we have year-round allergies that are getting allergens, I should say, that are getting more and they're getting worse and worse every year. So I'm noticing, having to put people on those medications in addition to the natural treatments.
Once upon a time, colloidal silver was popular, and I've seen it not as popular anymore. But what do you think of that?
I've worked with that. I did, my own sort of research into it, and I've worked with, yeah, I learned about it at the conferences and I tried it on my patients. It's one of those things where it'll work amazingly for some people and it doesn't work at all for
Mhm.
others. And there's also, you have to use the right kind of formulation. Otherwise, you can, collect too much silver in your system and that's bad for you. So there's some brands that are safe to use. It hasn't been one of those product that is so universally effective,
Mhm.
that I can just recommend it, to the general population. I'm sure, but there are people who swear by it and think it's amazing.
Wow. And you mentioned mold. So that's something that I find we've seen an increase in prevalence with that in our practice. And I'd love for you to maybe touch on your expertise with regarding mold and how, I mean, mold affects the entire body. And that's, once again, you probably see that. So yes, I mean, because it's definitely big down here. We have so much moisture in the air that, I mean, every time it rains, I feel people feel it. And everything's just wet and gross.
Yeah, I think people forget that New York is actually at sea level too. So even though it's Northeast, you don't tend to think of New York as being a coastal city, but it is a very coastal city and it's old and densely populated. And even, if some buildings have only been around 100 years or so, I mean, they're filthy. And
Hmm.
I have this joke that if the theaters on Broadway weren't so filthy and full of mold, I wouldn't have a job because so much of what I have to treat in those patients in particular is because of mold. And I mean, there's mold in the environment, right? So there's mold, and in Florida there are apartment buildings, obviously, but a lot of people live in actual homes. In Manhattan, especially, we're kind of stacked on top of each other, so it's a little bit different. But if there is, most mold condensation in New York, anyways, tends to be in the bathroom in these old apartment buildings. And just like the smallest amount of moisture with the heat will immediately start growing mold because there's so much mold in the buildings. But the other component of mold that I think isn't really considered is that mold lives in the ventilation systems. So in buildings, and in New York, all of our apartment buildings, the entire HVAC system is full of mold and also bacteria.
Hmm.
And they just live in these ductal systems. And then viruses can grow on top of that mold
Mm.
and bacteria. And so when we are turning on our air conditioning, people get sick from what's growing in the vents. So they're getting sick both because there's so much mold getting blown out. There's also bacteria blown out. There are viruses blown, onto them. And there's a lot of people get not just have an allergic reaction to it, but they have, if it's, toxic mold or black mold, or like really even more systemic. It's not just sinus congestion. They get rashes, headaches, chronic illnesses, fatigue, brain fog. There's so much of it that, yeah, I mean, I have, I mean, again, I don't know how typical it is in Florida for if someone gets sick for them to reach for a humidifier. But do they do that?
Not so
Yeah.
much
Yeah,
because
it's already humid.
yeah, it's pretty
Like
humid
I
here.
have to get
Yeah.
humidity
I mean,
out
in
of
New
my
York,
house.
the first thing they think of is, I'll get that humidifier out. And I'm just like, no, put it away. And they say, well, isn't humid air good for you? I said, of course, humid air is good for you. But if there's too much humidity in an old building that is, kind of been stagnant for a long time, mold grows in the environment. And it wreaks havoc on their bodies. And then, when your diet is full of sugar, then that candida will also grow inside of you. So you have
Yeah.
that external, environmental mold, and then you can have this internal overgrowth of candida and yeast, which is also a kind of mold.
And mold
Um,
can be an endocrine disruptor in itself too, right?
Absolutely.
So you might see weight gain unnecessary, like where you're like, what is happening?
Yeah, a lot of bloating, weight gain, brain fog. I've had patients have hair loss. And I don't think people really make that association. Like traditionally in medicine, we're taught that yeast overgrowth in the upper airway system is called thrush, oral thrush. And that's an indicator of having having severe immunocompromise. But when you really start looking, people have milder growths of yeast everywhere all the time. And it isn't necessarily thrush because it's not that high of of a candidal load, but it also isn't, it's not happening in people who are immunocompromised.
Wow. And so how do you do any mold testing for people to see what type of mold they have, or if it, or like whether it be PCR or IgG or IgE testing, or do you say, no, we can pretty much assume you have mold and let's go ahead and just treat it?
Yeah, this is an excellent question. So there's environmental mold testing that I don't totally understand why, but there are so many circumstances where you can see black mold and then mold testing environmentally will come up negative or normal. And maybe it's because their sensitivity levels are set where to be like extremely toxic mold. I don't know. Um, but I don't really, I don't base very much on the environmental tests. Like I really look more systemically and clinically, like what their symptoms are and the big picture of their symptoms. Um, and then in terms of diagnosis and treatment, I've been doing this. I think, for longer than there have been reliable tests for mold
Mm-hmm.
in Candida especially. So I've kind of adapted my practice to be diagnosed like a diagnostic treatment at the same time. And then if it works, we're like, we got the mold, we got the candida. And if not, then we go looking for other things. So my typical patient will have, a typical chronic sinusitis patient will have, will say, my nose is always running, I'm always sick or about to get sick. I can't tell, I've been on so many antibiotics, I don't know what to take anymore. And so I will do one of two things, usually try them on an antihistamine type treatment, go kind of the traditional allergy route. And if that doesn't work or doesn't work enough, then I'll them on something that I call a yeast cleanse. So it's a treatment, but it's also retroactively diagnostic if they do have a good reaction to it. And so I just kind of devised it using a lot of what I've learned in these integrative medicine conferences, but then condensed it down so that it's, the least amount of diet change, like the shortest amount of time for the best result without. And then the medication doses are, I think I've maybe had one or two people have reactions to them in the last, I don't know, 13 years. And I've put thousands of people on this diet. So it's a combination of a pretty low carb diet. It's not as strict as most Candida diets. There are definitely complex carbs. But there's no the only kind of sweetening agent is stevia or truvia or monk fruit. And then the carbs that are allowed are very specific. Like a certain amount of like sweet potatoes, brown rice, oatmeal. And then the rest of it is really, vegetables and meats. There's a few low glycemic index fruits on there. And so they have to follow that diet for 2 weeks and take like sort of a moderate dose of fluconazole, which is a yeast killer. And then they take a probiotic. And now there's so many different brands of probiotics that I kind of tell them what to take. They have to be probiotics that have no Saccharomyces in them. And I think most probiotics are not putting that, yeast in the probiotic anymore. So, and they have to do the diet and the medication for 2 weeks. And then the probiotic they have to stay on for 2 months. But they come in after 2 weeks and then I see how they are feeling. And I have to say, 75% of my patients are like almost cured with this
Wow.
treatment. It's unbelievable. And that doesn't mean they have to stay on the diet, but it really kind of, I think for me and my patients, it's had the highest kind of kill rate for mold and yeast. But it also has this like hidden component where it's really hard for them to just go out and eat processed foods. They have to cook food and think about food and think about additives in a way that they don't usually. And so I think it gives them a lot of awareness, a lot more awareness about what they're putting in their mouth and what's in it and how it's impacting them. So instead of saying, I'm going to eat a Snickers and I'm going to feel great, they go through this cleanse and then they eat a Snickers bar and they feel terrible, which is great. I kind of like when they
Yeah.
cheat because they'll say, wait, this is the worst thing I've ever done. So it gives them that negative reinforcement with a food that actually is bad for them, which is the opposite of what, we think diets are like. And then just one more, I guess, comment about this, that the way I think about Candida specifically, and I kind of group Candida and mold together, as a certain kind of organism that we're trying to impact in the body. So unlike bacteria that live a day, so if your bacteria lives for a day, and you have an overgrowth of bacteria, you take antibiotics for a week and you kill that bacteria and all kinds of other bacteria, right? We know that. But with yeast, it lives for 3 months. The life cycle of yeast is 3 months. And so it's very hard to have a high kill rate of yeast. Like the medication, fluconazole, can kill the adult yeast, but it's not really impacting the other growth stages. And I don't feel comfortable putting my patients on a long-term dose of fluconazole because of all the liver impact, the impact on the liver, and also because you can grow resistant yeast. You can kind of, end up with the yeast that doesn't die, and then what do you do? So the combination of that kill with the medication, and then the diet, which starves out yeast or the mold at all the other stages of growth, and then the probiotics, which increase the diversity of the microbiome and increase the competition. I found that it's essential to have the combination of those three at the same time, or it doesn't really make a big difference.
Wow, that's great. Thank you. And you kind of touched on this. Just to go show how diet can play a role in chronic inflammation. Mm-hmm. And people don't realize that.
Do you ever do food sensitivity testing with your patients?
Yeah, I've had mixed results with that too, because and remember, I'm in New York, so there are a lot of tests that are available. Yeah, excuse me, that we don't have access to. Excuse me, the mold. But there are a lot of integrative tests that are available in other states that we can't do in New York, which is also a reason I've kind of evolved around it. So the traditional food sensitivity testing, like the allergy testing, I found that it has very little correlation with upper respiratory symptoms. So there's a high correlation with things like anaphylaxis and other kinds of systemic responses, but the mucosal lining, the immune system of the mucosal lining is regulated by IgA, which is different than what you're testing when you do blood testing or skin testing. So it's very indirect. And I found even with environmental testing, like maybe a 50% correlation between the mucosal response and the tests. So it's hard. Like my patients, they want a concrete test. They're like, tell me what it is, tell me what to avoid. And it's we don't have tests for that, first of all. And second of all, with anything environmental, but especially food, these tests are testing for the protein, or the allergen that we know. But we don't have tests for, the chemicals in the air or, the preservatives in the food. So there's so much more that we're breathing in and eating that we don't have any tests for. We'll say, okay, well, maybe I'm allergic to, I don't know, make something up. I'm allergic to gluten, for example, but maybe it's not the gluten, maybe it's the preservative of a particular, brand of bread, that kind of a thing. But we don't have a test for that.
Exactly. No, you're exactly right on that. And that's something we do, the food testing, but that's something that I try to discuss too. And, and just even if they can make slight changes, like we know Candida follows sugar, like in sweets, right? So, even if they can just avoid like those things that you already put them on the diet, the food avoidance diet, that's very beneficial. Yeah. And so with your history, I'm really interested to see if there's any integrative therapies such as like imagery or breath work that you give to people who have like a voice strain or like laryngitis or like a vocal cord dysfunction.
Yeah, with my patients, it's all emotion. I'm kidding. So much of it's emotional. I think, there's this joke, my professional performing patients, right? So they always joke that they're crazy. I'm crazy. They wake up in the morning and the first thing they do is test to see if their voice is there. And then I remind them that I think public speaking is like the first or second greatest fear of people. I'm like, and you're getting up and not just speaking, you're singing, and everything has to be perfectly in tune, and you have no access, you have no way to access your own vocal cords and look at them or know what's happening. So it's, I mean, it's one of the most vulnerable professions you could imagine.
Yeah.
So, and there are the physical illnesses or ailments that impact their voice and their ability to produce voice, but a huge component of it is psychological and placement. And I send a lot of them for body work, and there is a lot of like imagery and body work and psychology, and the discussion of like, what is it about this? And why is this particular role? Why are you having trouble with this role when you didn't have trouble with, this other role? And so we really like dive deep into what's causing the issue. And then there's also like I had several patients like this where they're so allergic to the theater that the medication I have to give them causes other issues. So it's like this fine balance of like, what do we take and when, and how do we navigate this? And then they're so afraid when they get on stage that they freeze up because they're afraid of what's going to happen. I mean, that job is one of the hardest jobs you could choose to do.
I couldn't do it.
Yeah.
But yeah, there's a huge part of the professional voice is whole body physical therapy. Like I send them for something called laryngeal release, where they're really like physically releasing the muscles in their body because there's such a subconscious tension that they don't even realize. I call it muscle memory. And I've had patients where, it looks like one of the vocal cords is paralyzed. It's not moving at all. And it turns out it's because they're, more tense on one side than the other. And they're having this flashback memory of whatever it is. Yeah. And then they'll go for the right body therapy, and then their vocal cords move again.
Wow.
But that's a great example of how ear, nose, and throat manifestations, especially like in the voice, if I was really focusing in on their larynx and what their, video stroboscopy shows, that I'd miss the whole picture, miss the big picture, and also miss the diagnosis. And hormones, believe it or not, play a huge component, especially with women, in their voice and singing and voice production too. So yeah, everything I've learned in integrative medicine, even when I was doing the training saying, why am I learning about hormones? I'm an ear, nose, and throat doctor. It's had a tremendous impact on my practice and my patients and what I can diagnose for them.
I love hearing you say that, because we believe that hormones are key. I mean, you have to balance the hormones. You have to reduce inflammation and everything that you do in your practice. And it's amazing how everything ties in together, right? ENT sounds so specialized, but it's really not. It encompasses everything that we do.
Yeah, the symptoms are specialized, right? I think the symptoms are specialized, and there's certain dynamics, like the mucosal lining and understanding, how all this intricate, this really intricate anatomy works. Yeah. Like that's specialized. But you're right, the manifestation of it on those organs, it's the same as everything else. Hormones play a huge component in functionality. I had this patient recently who I diagnosed with polycystic ovary disease. She came in with vocal issues. And I was like, I'm like, this is what you have. And so she went back to her OB-GYN and endocrinologist, and they're like, who is this ENT? Because it seemed so obvious to me. Yeah. Of course, this is what's, because the symptoms will be things like headaches and dryness and not being able to hit certain notes. And if you just look at the scope, you'll completely miss the diagnosis because you're just looking at, what is an ENT, looking for polyps or hemorrhages or whatever, so it's really been a wonderful gift to be able to apply, integrative medicine for these very real, tangible, symptoms.
That's amazing. So let's switch gears for a second.
Okay.
Because one of the banes of our existence is chronic cough. People come in with a tickle in their throat. What's your approach to that?
It's funny because I have one now, so I can tell you. Excuse me. I think, yeah, I think about chronic cough a little bit differently as well. I think we tend to think of the cough as coming from the lungs, and sometimes it does. And we're really good at diagnosing when chronic cough comes from the lungs, I think. There's PFTs, pulmonary function tests, CAT scans, chest x-rays. There are a lot of different diagnostic measures for pulmonary-based cough. But what we don't have the tools for is what I call like a laryngospasm type cough. So a lot of cough, and a lot of cough that I see comes from hypersensitivity of the vocal cords. Because the vocal cords, even though we like to think their purpose is to create a voice, their primary purpose is to protect the trachea and the lungs, so that whatever's sort of dripping on the vocal cords, it can push them out of the way. So it's really to protect the airway. And so if the vocal cords are constantly getting dripped on or irritated, reflux less so, more so allergies and allergens and yeast and postnasal drip. I think postnasal drip in my practice is the leading cause of chronic cough. And so trying to figure out where that drip is coming from, and they won't notice it. They'll just say, I ask them, do you clear your throat a lot? And they'll say, oh, yeah, but I don't have allergies. I don't have postnasal drip. So you have to ask the question in the right way, or they're sitting there clearing their throat, like that, like the clearing of your throat. But throat clearing is a big hint that it's more upper respiratory based. And it's the postnasal drip or the dripping or even the mucus that collects on the vocal cords that triggers the cough. So if you think about it that way, then if your approach is really getting rid of that mucus through things like treating allergies, getting rid of yeast in the system, drying out the mucus, using air purifiers and dehumidifiers so that what they're breathing in isn't creating that drip, then most of the time you can get rid of that cough. One more comment about that I see a lot of is I have so many patients with a chronic cough that are put on steroid inhalers, and then it gets worse, and then they get more prednisone, and then they get albuterol, and then they get the combination inhalers, and then then they're on like 6 different medicines, and they're like, and my cough is getting worse. And that's a perfect example of a laryngeal cough, because those steroid inhalers grow so much yeast on the vocal cords that they make the vocal cords hypersensitive. And then if they're taking more steroids, then they have more yeast in their system. So I can treat those patients' chronic cough by getting them off all their medications, which sounds so crazy, right? Like I'll do the yeast cleanse and then, maybe switch out a lot of the steroids for something like Singulair. And then the other medicine I love using, not medicine, it's a supplement, is cordyceps. Cordyceps, the mushroom. Yeah, because it dilates the bronchioles. And so I have a lot of like asthmatic patients or patients with asthmatic type coughs that I treat with cordyceps, and it's very effective for them instead of medication. Uh-huh. So yeah, it's really, getting rid of that throat clearing and that postnasal drip, and don't think of it like obviously by the time they come to me, they've had all the pulmonary issues cleared, right? So I don't have chronic cough from like smoking. You have to rule out lung cancer. Obviously there's all these really important things to rule out. But when we're left with just this, why isn't this cough going away? I've had a lot of success treating the drip. But then there's also reflux. There was this bad phase in ENT where everyone was diagnosed with laryngopharyngeal reflux or silent reflux, which kind of drove me crazy because our whole esophageal lining and stomach lining is built to be able to tolerate a pH of 1. Like we need the acid. The acid isn't the primary problem. I think if there is too much acid or a reaction to the acid, it's a reaction. It's another symptom. So a lot of the like the reflux type symptoms that happen with cough, in association with cough, I don't think of them necessarily as causing the cough. I think of them as another manifestation of that laryngospasm.
Okay.
Well, I will say we're out of time for this podcast, but I have so many more questions I want to talk to you about.
We'd love to do another one with you.
Yes. So we will be scheduling you again to have you back because this has triggered more questions that I want to ask you. This has been so informative. Thank you so much. Could you please tell our audience a little bit like how they can find you if you have social media?
Sure. I'm on Instagram as Dr. Linda Dahl. It's spelled out Doctor, although that's mostly just all the Broadway shows that I go to. My website for my practice is Dr. Linda Dahl, but it's drlindadahl.com. And even if you're not in the New York area or you can't see me, there's a lot of information. So there's a lot of just information on my website about, like I have videos about the professional voice. I have a lot of articles about integrative care and the way the lining works. So it's, there's a lot of educational materials in there too.
And I'll post all of that in the show notes as well.
Great.
Thank you so much.
Yeah, really. Thank you.
Thanks for having me.
Awesome. That was great.
Yeah,
Thank
that was
you.
great.
And that really has triggered. I want to definitely